I'm Alex Guerrero. I am a trauma surgeon and the creator of the MTP Scorekeeper. The MTP Scorekeeper is a very simple device that was designed to overcome 3 problems that I saw every day working in the trauma center. 1, when you're giving a massive transfusion protocol, it's logistically difficult to keep track of your transfusion ratios. 2, oftentimes patients get an unnecessary amount of IV fluid as compared to the amount of components that they're getting. Problem number 3 is maintaining situational awareness, or in other words, avoiding task fixation. Okay. The first problem is overcome by having basically a system for logging the blood component therapies as you're giving them. One simple rule is when somebody spikes a bag, they push the button. So somebody spikes a packed red blood cell, you log it. Now this has the advantage that you can see it from across the room, you can see it during your surgery, you can see it at all times, and the whole team can see where we're at. It's essentially like a scoreboard on how the resuscitation is progressing. Okay? The same is true for your IV fluids. So if somebody gives a liter, you log that. Up here you have your timers. The first timer, most people use it when you either start your massive transfusion protocol or when a patient arrives in the trauma bay. When this button is green, you can switch it between red and green. When it's green, it means that every 10 minutes, that timer is going to give you a sound. And that sound is designed so that the entire trauma team can reassess resuscitation efforts, oftentimes look over, make sure that your ratios are balanced, and reassess the patient quickly. The second timer is used when you're rushing the patient to the operating room and you're doing a damage control case so that you can monitor your time in the operating room. So the way I like to do it is the MTP Scorekeeper lives on top of a Belmont. You start your massive transfusion protocol in the trauma bay. You start the timer when the patient arrives. When you get up to the operating room, you bring the Belmont with the tubing and the MTP Scorekeeper and you start your case. Now, the way I like to do it is I start the second timer and then I switch it so that I'm hearing the every 10-minute chimes during my case. So every 10 minutes, I glance up and I take 10 seconds to give a quick report on what's going on, and I ask each team member for a quick status update. Thank you very much. If you have any questions, please feel free to reach out to us. Thank you.